Hi, I'm Lisa Brandenburg, president of the UW Medicine Hospitals and Clinics.
Good morning. I'm Tim Delitt. I'm the Chief Medical Officer for UW Medicine and President of UW Physicians.
And we're here this morning because the two of us wanted to take an opportunity to thank all of you who have worked so hard in the UW Medicine team. I have never been prouder to be part of UW Medicine and what I have seen with the frontline staff, doctors and nurses, the support staff working with the patients, and all the staff in the background that are making that work possible. It's incredible, and I just want to say thank you from the bottom of my heart.
You know, the response of our teams has been truly inspirational. We also recognize this has been an incredibly challenging time for all of our team members, both at work with the changes in how we're caring for patients, as well as at home with all the social distancing measures in place and the disruptions within our personal lives. But watching everyone continuing to have that dedication and commitment to our patients, to your colleagues, and to our community has been incredibly wonderful to watch.
We are cautiously optimistic that we're starting to see that curve flattening. We have about 112 patients in our 4 UW Medicine Hospital campuses today, and we're watching that carefully. We think that there's progress, but we're still prepared if we need to be prepared for additional patients. But I think it's important we all take the actions that we have to take seriously. Tim, do you want to talk about that?
Yeah, I share that cautious optimism. I think there is some light at the end of the tunnel, but we still have a lot of work to do. We're actively planning, implementing our approaches to respond to the COVID-19 pandemic, not only here within UW Medicine, but also in partnership with all the other healthcare systems, with public health, the Department of Health, the Washington State Hospital Association, the Northwest Healthcare Response Network. This has been an entire community effort. And the reason we have this cautious optimism is because of the response of our community. We are seeing the flattening of the curve. We are seeing lower numbers in the projections than what the initial models showed. And it's because of all of you and all of the efforts that we're doing, not only at work, but all of the physical distancing measures that we're doing within our community. It is working. And so while this has been incredibly difficult for our community, we have to keep those measures in place, at least for the short term. And again, following the leadership within our state, because those measures have put us in a much better place now than some places around the country. And again, it's because of those implementation of those measures. And so we all look forward to the day when we can be together and not doing Zoom meetings. But we have to make sure that transition is thoughtful, and we want to make sure that we don't see a rebound in cases. And so again, I really appreciate everyone's efforts because we know this has not been easy.
Yeah, and I think I would just echo Tim in saying this has not been easy. It's not been easy for us all at work. It hasn't been easy for us at home. But we can't let our guard down yet. We can see, we think, light at the end of the tunnel, but we need to stay prepared. In that same way, we need to stay prepared for a surge of patients in case that could happen. We need to keep our guard up and continue the actions that we're all doing at home, social distancing, washing our hands, and taking this very seriously so that we can continue to see this flattening of the curve. And I just want to join Tim in thanking everyone who's doing that work every day.
You know, I'd also like to thank everyone for the concerns that you've raised along the way as well. Again, recognizing that we have continued to learn as we've gone through this. This is an unprecedented experience within medicine, particularly over the last century. And so as we learn together, as new ideas come forward, we have really valued that input and thinking about, well, is this the right way to do things, or how can we do things better? And so again, continue to share those ideas with us. We really value your flexibility and your partnership, because this is, again, it's a team effort in our response. And again, we are seeing the benefits of that response and doing this all together.